Hello, I'm Sean Samon Park, prosthetic urologist practicing in Seoul, South Korea. My field of specialty is a penile implant, especially inflatable. Recently, I went to US to attend the SMSNA meeting, and right before that, I was fortunately able to go visit Dr. Carrion's practice in the University of South Florida. Dr. Carrion and his father, Hernandez Carrion, both of them are legends in the field of prosthetic urology. His father, Hernandez Carrion, invented the first semi-rigid penile prosthesis in 1972. After that, Bradley Scott invented the inflatable. So, father Carrion and son Carrion, both of them are continuing their legacy in the field of prosthetic urology. In the year of 2016, when I was pretty early in my career, I was lucky to see how he does the surgery when we all went to the ISSM meeting in São Paulo, Brazil. So we were invited to the local surgeon, and he had some difficult cases, so we all went to the OR and did the case. My mentor, Papa Wilson, took the Dr. Carrion's fellow to the OR, and I went to the OR with the Dr. Carrion. He definitely has a different style than the Dr. Wilson. He was a great surgeon. So ever since, I always wanted to go visit him. Meanwhile, one of his former residents, Tim Juano and Hanahan Guan, came to my practice and got a short training with me. And all in all, finally, I was able to go visit him 8-9 years after, since I won it. So it was one of the things that was on my bucket list. The first day, Monday, I went to the Tampa General Hospital to sit in his OR day. It was a really busy OR. They had 7 or 8 cases. He had a whole team of them, like 2 fellows and 5 residents and 1 intern, I believe, and medical students. So they were all under the Dr. Carrion's wing, and he had 3 ORs running at the same time. So they were doing the surgeries, and he was running around, checking them out, see the patient, pre-op and post-op and everything. One thing really surprised me is that how great the training system was. Dr. Carrion pinned it down to the point where they should touch this and touch that, and he lists them all, so they all memorize it, and they were exactly on the path how to do it in the right course. Fellows, one of them, Brittany Ottawa, had a chance to see her in person and was able to work with her in the previous writing a paper. So I knew her before, and they were doing the difficult cases together. Surgical techniques are not that hard to teach or show. However, when to use this technique, how to apply this, that's a different story. So decision making is something that surgeon really needs to learn. However, it's really hard to train. And I think it's most of it coming from the trainers. He was very patient, but he didn't let anything go down. He having always on the eagle's eye, kept on the OR field. In my eyes, he was waiting intentionally for them to figure out how to go further. Because they are well trained, and it's all in their head, but they were not able to apply it like that. And sure enough, they applied it and they solved the case amazingly. So the 4th case was a difficult case patient, and he is a Korean American, surprisingly. And right before the surgery, I went there, and the patient recognized me because, I saw you on YouTube, and yeah, but I told him, feeling awkward, that I'm here to learn. I'm a student today, and Dr. Carrion will take best care of you. And after seeing him, Dr. Carrion told me that if the surgery doesn't go well, he told me that he'll go to Korea to see you. So no, he didn't have to, because they took such a great care of him. Overall, it was a great experience. And next day I had the outpatient clinic. Outpatient clinic was just amazing. And what I really enjoy about watching them, the outpatient, is that almost always he was greeting the patients like his close friend. The patients were happy, being very friendly, and I think human beings does need that kind of human touch, and he was exactly giving that to the patients. But however, as I'm getting old, I guess, doing the traveling like this, taking a 16 hours flight, because jet lag, you wake up in the 3 a.m. in the morning and can't really sleep. Even with all these difficulties, I felt I did the right thing. Because this is exactly what surgeons need, or doctors need. Because they have to open up their eyes, widen their views, so that they can see their practice in different perspective. That's when you can move it to the next level. I want to shout out that all my thanks to Dr. Carrion and his team, his wonderful team. And again, in here I'll try to apply things that I learned from him to take the best care of my patients.